Hi, everybody. Welcome to Chapter 12, Head and Spinal Injuries. So we're going to kind of hustle through this. It's a big chapter, and so just be aware of that. If you need to stop and take notes, feel free to pause the video. You can kind of go through it at your own pace. So keep that in mind as we go through this. All right. So when talking about head injuries, I mean, your brain is your most important organ in your body. So it is always potentially serious when we're talking about head wounds. So keep that in mind. Any type of scalp wound or even like superficial wound on the head is always potentially dangerous. Of course, skull fractures and brain injuries are always going to be dangerous because of the effect they can have on the brain. The other thing to keep in mind this is going to be a recurring theme throughout this chapter is spinal injuries also have the possibility of showing up anytime you have a head injury, and so you have to definitely watch out for that, and we'll get into that a little bit more. So, scalp wounds, the biggest thing you're going to have with scalp wounds is the bleeding. As long as there is no skull fracture present, you can apply direct pressure onto a scalp wound. There's tons of blood vessels in the head, so it is going to bleed. So definitely the bleeding is going to be the number one priority. If there is any sort of a skin flap that is out of place, apply that to the original position, kind of like when we talked about avulsions, and then apply pressure. All right. So, continuing on. If there is a skull fracture suspected, excuse me. When it comes to applying direct pressure, you're going to do it just a little bit differently. So make sure that instead of pressing directly on the wound and risking putting pressure on the brain, we're going to put pressure around the edges of the wound. That is a quiz question. Make sure you put a star by that one. For other scalp wounds, just the same as we do with a normal wound, try and use a dry, sterile dressing. If you can use elevation with the head and the shoulders to help to let gravity be your friend, that's always helpful. If the bleeding continues, again, continue to add dressings over the top. Don't remove the original dressing. If the wound is extensive, if there's significant facial damage or other signs of concussion with those different injuries on top of each other, call 911. Nobody needs to have significant scarring over their face. So if we can get that taken care of, the risk of bad scarring decreases. So as far as skull fractures, some things to look for. Of course, pain. It's going to be very painful. Anytime you find some sort of a deformity actually on the skull, like it looks like it's pushed in, that's a big sign. Anytime you get bleeding from the ears or the nose, and there was no direct, especially if there was no direct contact with the nose, like that is a classic sign of a skull fracture. Anytime you get leakage of CSF or cerebrospinal fluid, okay, that's a new word for you guys. You'll be able to see this as I type this down on the notes so you can see what it looks like. Cerebrospinal fluid. That's what CSF stands for. Okay. Anyway, that is very indicative of a skull fracture. Typically, it's going to come from the ears and or the nose. It's kind of a clear, milky-ish color, but it can also be mixed with blood, so it's almost going to look like the blood would be kind of watered down. But yeah, that's a very big sign of a skull fracture. Anytime you get discoloration around the eyes or behind the ears, which is this, right? These pictures here, That's a big one. Anytime the pupils are unequal, that typically means there's some sort of damage to the musculature around the eyeballs, and that comes from a skull fracture. Again, the heavy scalp bleeding, that is, you probably want to make sure it's accompanied with other signs before you just rely on that one. And then, of course, anytime there's a penetrating object, obviously there's not a lot of skin or tissue there to penetrate for an object, so there's probably a skull fracture as well. This is also a quiz question, so make sure you put a star by this. Battle sign, along with this discoloration behind the ears, that's what battle sign is. That's a classic sign of a skull fracture as well, that bruising that happens behind the ears like you see in this picture here. Okay, so as far as what to do, you're going to want to apply a sterile, clean dressing over the wound, and then try and hold it in place with some gentle pressure. Again, don't put pressure directly over where the fracture site is, but around it to help control any bleeding. A donut pad is a really good way to apply pressure and or control bleeding without putting pressure directly over it. I showed you guys this in class, but this is a example of how to make it. It kind of looks like this. That way when you wrap the ACE wrap over the top of it or whatever bandage you're using to secure it in place, the pressure is on the padding around the wound instead of directly on the wound that would be in the center of this pad. And of course, anytime you suspect a skull fracture, you should call 911. That's really serious. We need to get that person to the correct care. All right, traumatic brain injuries. A traumatic brain injury is any sort of injury to the brain, but it will cause short and or long-term issues. Okay, these aren't always characterized by like a penetrating wound that there's bleeding and stuff involved. This can just be caused by a blunt force trauma of some sort. Okay, anytime these traumatic brain injuries are mishandled, it really is dangerous and can have a big effect on this person's life, maybe even end their life. Anytime the brain undergoes some severe injury of some sort or trauma, it tends to swell. And that swelling is what interferes with brain function. It's not always life-threatening, but like in the case of a concussion, which we're going to get into in a little bit, the brain does swell, and it changes the function of the brain and can cause some issues, right? So all those issues we see with concussions, the confusion, those types of things all come from this swelling of the brain. And we'll get specifically into that in a minute. Brain injuries, again, can be caused by a lot of things. A penetrating object, any type there's bony fragments from a skull fracture, or if you have a rapid slowing down of the movement of your skull, right, like whiplash, or this is what happens with a hard hit in football, hitting your head on the ground. So your head is moving quickly and hits something solid and stops very quickly. That will cause the brain to strike the inside of your skull, and that's what a concussion is. Okay, so there's 3 different types. There's a deceleration injury. So if the person's head hits a stationary object, that's deceleration. Anytime there's an acceleration injury, that's when somebody's been hit by something that's moving. Tons of examples of that. And then a coup counter coup. I honestly am not 100% sure how to say that, but that's when there's 2 points of injury. So there's an injury at the site of impact of something, as well as if somebody were to be hit by something and then hit their head on something else, there would be an injury where they got hit with the object, and then when their head contacted the immovable object, right? So there's 2 different points of injury. Okay. So talking about concussions occur when there's a blow to the head that alters brain function. Most of them are not super serious. They'll resolve within 7 to 10 days. They're really not anything crazy. I mean, of course, concussions are a big part of what I do as an athletic trainer. And in my experience, the biggest thing I've learned about concussions is just how different they are from one concussion to another. Some people get tons and tons of symptoms, and some people just don't. They'll have a few symptoms that first day, and then the next day it's like it never happened. But I've also found what a difference it makes to follow the protocol or the recovery protocol so that people are safe. And when the protocol is followed correctly, people tend to recover much better. So anyway, in general, concussions are not super serious. If you get one, if you only get a couple of them, and if it wasn't like a massive blow, they can be pretty mild. And most people recover fine. Every once in a while, you get those ones that take a little bit longer. Okay? But the ones that I want to make you guys aware of today are the ones that don't recover quickly and why we take them so seriously. It's not those ones that people do recover from. It's the ones that people don't recover from. So, we're going to talk about post-concussion syndrome or second impact syndrome. That happens when somebody gets a concussion before they've recovered from one. So, for example, if a football player gets a concussion and we send them back out to play and they get hit in the head again and suffer another concussion before they've recovered from the first one, they can get this second impact syndrome or post-concussion syndrome, and it is life-threatening and life-altering. As you can see, concussions, like it's not the original concussion that we're so concerned about, but the reason that we're so careful with these, even with mild concussions, is because of this. Right? He could have died. His brain swole up, and they had to remove his skull just to relieve the pressure. A piece of his skull, should I say. So this is why. And am I trying to scare you? Maybe a little bit. But really just so that you'll take it serious. And this is because this is life or death when it comes to concussions. Okay, so talking about some other traumatic brain injuries, just regular contusions or bruises, same thing. We talked about the counter coup a little bit. Diffuse axonal is the shaking or a strong rotation of the head that can cause a tearing injury in the connective tissue around the brain. And then a penetration injury, of course, would come from an object that causes penetration. Okay, so some things to look for as far as traumatic brain injuries. Those cognitive or mental skills are going to be diminished. People will feel slowed down. They'll have a hard time thinking clearly. Concentrating will be a problem. And they'll have issues remembering new information. Then you have physical symptoms, of course, a headache. The one thing I have noticed about concussions and a lot of these other brain injuries is the pain isn't just where they got hit. It's like diffuse throughout their whole head or a larger portion of their head. They may have fuzzy or blurred vision, nausea or vomiting, dizziness, sensitivity to noise or light, balance problems, and they may feel tired or just really out of energy. Not even sleepy tired, but just like worn down. Let me check. Okay. And then they will also have emotional or mood symptoms. Like people will have like mood swings or be more emotional than they normally would. I remember when I was in high school, I got a concussion and it was the last football game of the year. I was a junior, and I was just like so emotional. I could not, like, yeah, I felt like garbage, but I was like, I could not believe that I couldn't play, and I was just like bawling on the sideline, which is totally not like me. But we also see the opposite. We had a football player last semester that got a concussion, and normally he's a very upbeat and like happy guy, and all of a sudden he was just like nada. Like usually he would be like dancing around or singing at practice to the music, and he was just like very quiet and solemn all of a sudden. So it does swing both ways. Okay. Also, it can have a pretty big impact on sleep. They'll feel like they want to sleep more than usual, or there are some that just have a really hard time falling asleep. That's pretty common. That's also a big thing. Okay, so again, we don't really treat these as at least immediately any different than we would anything else. If they're unresponsive, unconscious, those kinds of things, we're going to treat it like normal, check for breathing, and move to CPR and those things if necessary. Anytime you have a head injury, you must suspect that they have a neck injury, and that has to be ruled out before you can move them. So if you'll notice, if somebody gets hit in the head or they become unconscious, we will always run out onto the field as an athletic trainer, right? Always run out onto the field. We will always rule out a neck injury before we move them. We'll feel around their neck, make sure their pain is not directly on their spine before we even think about moving them. Okay? If you do suspect a neck injury or they're unresponsive, of course, we're going to call 911. Okay. If the person is wearing a helmet, you're not going to take it off unless a few things. If you suspect that they may have an obstructed airway, then you need to get it off so that we can perform CPR. If you can't stabilize the spine with the helmet, you can take it off. I mean, I've had training on CPR with helmets and stuff. You can stabilize the spine with a helmet on. You can do it. Okay, just use your forearms to hold it in place. Again, if you need to remove it to be able to get to somebody's airway, remove it. So this is a quiz question. Now, I'm going to clarify this. This is, immediate medical care. This is call 911. Okay? So on the quiz, when it asks you to seek immediate injuries you need to seek immediate medical care for, these are ones for, like, this is so serious, I'm calling 911. Okay? Drowsiness, like cannot stay awake type drowsiness. Okay? If there's one pupil larger than the other, that's serious. Seizures, especially if it's their first seizure ever, okay? Or if it lasts longer than usual if they have seizures normally. Or if you're unable to get them responsive after a seizure, okay? An inability to recognize people or places, like no idea where they're at, those kinds of things. Again, severe confusion. Restlessness, they just cannot calm down. If you know the person and their behavior is just very highly unusual, something to be concerned about. Again, unresponsiveness, obviously. Headaches that get worse and or don't go away, that is a sign of a brain bleed. So if the trauma to their brain was bad enough that their brain is starting to bleed, the headache is going to continually get worse. Okay. Anytime rule of thumb for a concussion, if they throw up more than once, send them to the ER. Have them get seen right away. Okay, that's another sign of a serious brain injury. Or if they're unable to talk or have any sort of slurred speech, that is a very serious type of neurological symptom or symptom of a brain injury. Okay, there may be damage to the brain that's not just concussion related. Okay, so following a traumatic brain injury, make sure that, by the way, I don't know if I mentioned this. This is a quiz question. And I didn't mention it earlier, but when we talked about these symptoms of traumatic brain injuries, these are also a quiz question. So these 3 slides right here: thinking, remembering, physical, emotional, and sleep disturbance symptoms. Okay, so getting back to it. The care for after a concussion or a traumatic brain injury. So, a couple of things. It's like an old thing that after you got a concussion, you're not supposed to sleep. That's for people, like if you get a brain bleed, if somebody falls asleep and you cannot wake them up, then that's a sign of a brain bleed, right? They all of a sudden become unconscious. Then it becomes really serious. That's the newer thinking or the newer research has shown that sleep is good for somebody who has a traumatic brain injury or a concussion especially, okay? They can sleep, they can get rest. But you really, especially for those first 24 hours or so, you really should not leave them alone. Somebody should be with them, have the ability to check on them periodically. You could wake them up. Then if somebody doesn't wake up in a reasonable amount of time or at a normal time, then we're going to be really concerned, right? Try and avoid visual or sensory stimuli. So scrolling on somebody's phone, like that's pretty not good for a concussion. It can really make the symptoms worse. You need to ease into normal activity slowly because of it can have an effect upon coordination and those kinds of things. You need to be kind of careful. Avoid strenuous physical activities. Straining yourself early on after getting a concussion can bring back those symptoms because, believe it or not, it puts stress on your brain to be active. Again, avoid another blow to the head or body because of that risk of second impact syndrome. And then do not use aspirin or anti-inflammatory medications except for acetaminophen or Tylenol. Okay, so ibuprofen, naproxen, aspirin, those drugs you do not want to use immediately following a traumatic brain injury or a concussion because if there is some sort of a brain bleed, okay, a slow brain bleed, those drugs, ibuprofen, aspirin, naproxen, or NSAIDs is what they're called, the category, they are also blood thinners. So they will thin out your blood and make it harder for your blood to clot. And if you have a brain bleed, you have a bleed in a very serious spot, if your blood can't clot, then it's going to be much harder to get the bleeding stopped. So that's why. Okay, so other care or getting more care, going to the doctor, you would want to do if somebody's headache lasts more than 1 or 2 days, the nausea lasts more than 2 hours, if vomiting starts to happen hours after that initial concussion, or they threw up once and then they throw up again hours later, that's a big one. Again, confusion or disorientation after physical activity, vision changes, any type of mobility or speech impairment, and then seizures and or convulsions. Let's go see the doctor right now. All right. So that was concussions. Okay, now we're going to move on to other head injuries. So eye injuries, the eyes are very, very fragile. Okay, easily damaged by any sort of trauma. If you have some sort of an eye injury, they need to be seen by the eye doctor as soon as possible. Okay, or a doctor if there is no eye doctor available. Right? Like, not a lot of eye doctors that work in the ER or anything like that are after hours. So, just go see a doctor if that's all that's available. Okay, so when it comes to a blow to the eye, some things to look for. Of course, a black eye, bruising around the eye. If the person reports being hit by an object, getting punched, something like that. If there is a fracture around the eye, some things to look for. First of all, it's going to be real swollen. It's also gonna hurt like crazy. There may be a deformity, but these two are pretty. If these are present, that really increases the chance that there's a fracture, almost certain. Okay, double vision, or if they can't look upward, that means there's a disruption in the musculature around the eye, which happens if there's a fracture. Okay. All right. So if somebody has a blow to the eye, apply some ice or a cold pack around the eye for 15 minutes. We don't want to place it directly on the eye. The ice can damage the eye if you put direct contact on it. So have the person close their eye, then put the ice on. That's fine. Okay. Again, have the person keep their eyes closed. Try and limit the movement of that eye, especially if there's a fracture suspected, and then seek medical care as necessary. So, loose objects in the eye, some things to look for. Most of the time, it's not a big deal, but if you get something in your eye that you can't get out, or a large piece that can cause damage, the pain's gonna be more severe, and there may be tearing in the eye. Okay, so as far as how to take care of it, have the person blink several times. You can pull the upper eyelid out and over the lower lid. That will help to remove the object from the eyelid if it's stuck in your eyelid. And then also gently irrigating with clean, warm water. If you'll use a syringe with a little bit of pressure, that will also help. A little bit of pressure, not a ton. So like I was talking about, you can pull the eyelid down over the upper eyelid, or some other ways you can do it. You can pull that lower eyelid out and then use something to like sanitized gauze or sterile gauze to pull it out, like in this first picture. Or you can, if it's in the upper eyelid, you can use a Q-tip kind of as like a tool, I guess, and you pull the upper eyelid out over it to kind of protrude that eyelid out. Then you can, with a gloved finger or sterile gauze, pull that object off. All right. If there is a cut or a scratch on the eyeball or the eyelid, here's some things to look for. You may see a cut on the cornea or the sclera. So the cornea is the outside lining of your eye over your pupil and iris, like the color of your eye. Your sclera is the white of your eye, not over your the white of your eye is your sclera. Okay. If there's any sort of liquid coming out of the eye, that is bad. Or if you see a cut eyelid, okay, any of those are very serious. They need to be seen immediately. So what you should do to take care of it, again, don't apply direct pressure. We don't want to push any fluid out of the eye. Cover both eyes with gauze pads, and you can lightly wrap them on and then call 911. Okay, any sort of penetrating eye injury, we did talk about this a little bit with wound care. What we're going to do, don't pull the object out. For the bigger objects, we're going to put the cup over it, okay, and then use the gauze to wrap it in place. Or we can use the donut pad like we talked about earlier. Okay, for a short object, again, donut pad around the eye, wrap the bandage around the head to hold that pad in place. Again, we're going to cover both eyes so that they're not moving the object around when they look around, and then we're going to call 911. Okay? All right. Anytime there's chemicals in the eye, again, we're going to flush it out with warm water for at least 15 minutes. Put that eye that has the chemical in it down so that gravity helps us, so that gravity's not pushing it into the other eye. Loosely bandage if it's necessary. You can call the Poison Control Center if you don't know what it was that they got or you don't have access to the safety data sheet. this is the phone number for poison control. That's a good number to have. We'll talk about this more later in the semester as far as poisoning goes, but that's just a good number to have in your phone. Okay, eye avulsion. So, what an eye avulsion is if your eye gets knocked out of the socket. Hard to miss. Okay. What you're going to do is you're going to cover the eye loosely with a sterile dressing that's moist, okay, to keep the eye moist. You're going to protect it the best that you can, and then cover the undamaged eye with a patch so as to not have them looking around, and then you're going to call 911 right away. Okay. Anytime somebody gets a burn caused to their eye by light, you can get a sunburn on your eyes. Okay. If you're out on the water too long without sunglasses, without any sort of protection, it can cause this. So take care of your eyes. Sunglasses are a good thing. They don't just look cool. They may have severe pain 1 to 6 hours after that exposure. To take care of it, cover both eyes with moist, cool cloths. Give pain medication. If it lingers for too long, definitely go get some medical care. Conjunctivitis. Okay, so the common name for conjunctivitis is pink eye. Okay, so if we go back to our eye anatomy picture, okay, the conjunctiva is the very outside lining right on top of the cornea, right here. Okay. So, the conjunctiva, if you get swelling or, inflammation is what I meant to say. Inflammation of that conjunctiva, it is pink eye. Some other things to look for. You're going to see redness of that sclera. The whites of your eyes are going to be pink. Okay, hence pink eye. Itching or a gritty sensation in the eye. They may have an oozing discharge, especially in the mornings, like waking up with your eye that has crusties on your eyelids. Somebody who is tearing up a lot, more than normal. Eyelids may be swollen. Again, those dried crusts in the mornings that may crust your eyes shut. And then discomfort by those bright lights. These are all signs of pink eye. This is a quiz question. So as far as taking care of it, you can use a cool rag or cool gauze over the eye. You can use artificial tears to dilute whatever caused it. And then seek professional medical care if the signs and symptoms don't improve after 3 to 4 days. Okay. So, subconjunctival hemorrhage. What that is pressure has caused the eyeball to rupture underneath that conjunctiva. Okay. So some things to look for. Only one of the eyes will be affected. It's not going to happen in both eyes. They may have a red patch or a large area of redness in the sclera. Most of the time, it's not going to cause pain or visual changes. It's really not going to be all that debilitating. Okay, it can happen in people with an eye injury or if they've sneezed super violently. Can also happen during a bowel movement or with heavy weightlifting. Or if somebody is taking a blood thinner, it can cause this. The biggest thing is it's not serious. Okay, you don't have to treat it. Don't use eye drops that are used to remove redness. It's not going to help. Okay, it is safe to do normal things, but it's really not debilitating or life-threatening or vision-threatening, should I say. Okay, if there is an injury to the eye, okay, and we're worried about what's called a hyphema, which is what we're going to talk about next, then you need to see medical care immediately. So a hyphema is a visible pool of blood in front of the iris of your eye. So over the color of your eye and your pupil, if there is blood there, that's what's called the hyphema. It will impair your vision, and it's going to be painful. We actually had one of these in a basketball player at the very beginning of the season. And it was actually a couple of days after I gave this lecture last semester. So it was like pretty clutch timing-wise. So what to do? This is an emergency. We need to try and limit this person's activity, keep their eyes closed, and cover that eye with a patch. We don't want them looking around a whole bunch. We want to protect this eye from being hit again. Try and elevate this person. Don't let them lay down because we don't want the bleeding to continue. And this person needs to see medical care right now. Okay, this is sight threatening. All right, so moving on from eye injuries, now we're going to talk about ear injuries. So most ear injuries are not life-threatening. They can be debilitating or can affect your hearing, of course, but they're not going to kill you, okay? Really, the only things inside the ear that need to be removed immediately would be disc batteries, so the little silver flat batteries, and or live insects, mainly because disc batteries, if they get left in there, the acid can leak out, and that would be a real bad deal. And then, of course, live insects, like who wants a live bug in your ear? That's gross. But also, live insects can cause damage. All right. So, if there is an object stuck in somebody's ear, don't use tweezers to pull it out unless you can see it near the opening. Okay, don't go digging around in there. You just risk pushing it in further. Okay, get medical care to take it out if you can't see it. If there's a live insect, try and shine a light in there. See if you can get the bug to crawl out. You can pour warm water into the ear and then drain it out. Most of the time, that'll take care of it. If you can't get the bug out, then get medical care. So if there's fluids coming from the ear, don't attempt to stop the bleeding or the CSF. That's natural. With a skull fracture, the body is trying to drain drain fluid to remove pressure. So just place a sterile dressing loosely over the ear, like a cotton ball or something like that. Stabilize the head and neck against movement and call 911. Okay. Oops. All right. So nose injuries. Moving on from ear injuries. Most nosebleeds are really not a big deal. I mean, most of us have probably had a nosebleed. You stopped and you were fine. It stopped and you were fine. Okay. In cases where there are other injuries, especially to the head or neck, then we're going to take it a little more seriously and get it taken care of. Okay. For a broken nose, things to look for: pain, heavy swelling, and or bleeding that you just can't get stopped. It may be difficult to breathe through your nose. And then most of the time, the person, if they have a broken nose, they're going to get black eyes shortly thereafter. If it is bleeding, try and take care of the bleeding. You can use ice or a cold pack over the person's forehead and the nose to help with the pain and or help the bleeding to slow down. Do not try and Do not try and straighten a crooked nose. You guys aren't doctors. You guys aren't orthopedics. The chances of you making it worse are pretty high. So allow somebody with the proper training to take care of that. Okay, nosebleeds. So some things to look for. There are two types of nosebleeds. There's anterior nosebleeds, which if you remember from when we talked about directional terms, anterior is towards the front. So that's in the outer portion of your nose. These are the most common types of nosebleeds. Posterior nosebleeds are deeper down in the nasal canal, even down towards the throat. Those ones are less common, but they're much harder to stop with bleeding. Okay? If the nose was hit directly, you may suspect a broken nose, so you're going to be a little more cautious with moving the nose too much. Have the person slightly lean forward, and then pinch their nose and hold it constantly for 10 minutes. It's pretty simple. Don't overthink it. Just pinch the nostril off for 10 minutes. Use gauze or something to help soak up any of the blood that comes out. But you're going to want to hold it. If you keep checking it every 2 seconds, it's not going to stop bleeding. If the bleeding doesn't stop, you can have the person gently blow his or her nose. In my experience with nosebleeds, when you get a heavy clot and you're able to get the clot out, a lot of times it will stop. Once you've had them blow their nose gently, then close it off again for 10 minutes. And again, if bleeding continues, you can try other methods. We did talk, I don't remember if it was with both classes or one of you guys, but anyway, you can use the foot kick method. I used that a lot growing up because I used to get lots of nosebleeds. You have the person lay flat on their back, straight as they can with their arms at their sides and their heels together, and then you, with the side of your foot, kick the person's heels hard several times. Don't ask me how it works. I have no idea, but it works. Okay, as far as after a nosebleed, some things to help prevent further nosebleeds. If you have to sneeze, try and sneeze through an open mouth. This decreases the pressure and the chances of reopening that. Try to avoid as much physical activity as possible, which seems counterintuitive because we do this all the time with athletes and we're just like, just go back in. You can. It's just going to increase the risk of bleeding some more. So if it's not real important, then take a break. Okay? Elevate your head when you're laying down. Just prevents you from swallowing the blood. If you swallow it or it goes down your throat, it's not stopping. Okay? Keep your nostrils moist. You can use Vaseline or like first aid cream, things like that, to grease your nose, especially if you know you're prone to nosebleeds when it's dry outside and those kinds of things. If you'll grease your nose, that will keep it from drying out, cracking, and bleeding. And then avoid picking or rubbing your nose, because don't pick your nose. All right. So, if somebody has a foreign object in their nose, okay, have the person gently blow their nose while compressing the opposite nostril, so all the pressure's coming out that nostril. If it's visible, you can try and pull it out with tweezers. If the object can't be removed, then you're going to have to go see medical care. Okay, as y'all become parents, this is a legit thing. Kids put stuff up their nose sometimes, and it's not good. Luckily, haven't had that issue yet, but it's always a possibility. Okay, anytime there is an object caught between somebody's teeth, okay, you may or may not see it. If you can if it's possible, try and remove it with dental floss. If you're not able to get it out, have them go see a dentist. Don't overthink it. If somebody bites their lip or their tongue, probably going to have some immediate swelling, bleeding. It's really painful. Anybody who's done it sucks. The biggest thing, you can try and apply direct pressure. Either I would probably have the person do it. You can also just put gauze in their mouth and have them push their tongue against it. Or push, if it's their tongue, push their tongue against the side of their mouth against some gauze. Cleaning, most of the time these aren't real, it's not going to be super dirty. But you do want to try and keep the person's mouth somewhat clean. And then if the bleeding doesn't stop, go seek medical care. Now, as we talk about these mouth injuries, one thing, mouth injuries, because of the tissue inside your mouth and the type that it is, mouth injuries heal very quickly for the most part. So that is one nice thing. Injuries to the inside of the mouth don't stick around for too long. Okay, so bleeding from the mouth, allow the blood to drain out, and then basically we're going to take some sterile gauze, put it in there around the wound and have the person apply some pressure. Okay. If they do have a cut through their lip or their cheek, then just like when we talked about like fish hooks and stuff, or when we talked about cuts from the outside into the person's cheek, we're going to put gauze on the inside and the outside. Okay, and then seek medical care as necessary. If somebody has a loose tooth, you're going to want to put pressure on either side of the tooth, okay, to help with bleeding. You can have the person bite down on gauze. If it's super loose, you're then going to want to have them consult a dentist to see if they can get it fixed. Toothache. Things to look for: pain. Tooth's going to be super sensitive, especially to different temperatures. You may be able to see decay around the tooth. Cavities and stuff, that's usually what leads to these toothaches. Have the person rinse their mouth out with warm water. If there is objects in between the teeth causing it, you can use floss to try and get it out. You can use an ice pack on the outside of the person's mouth, and then give some pain medication, acetaminophen, ibuprofen, those kinds of things. And then, of course, seek a dentist if it's real bad. Okay. Almost there. If somebody has a broken tooth, what you should do, you want to collect the tooth or the fragments. Okay, there is a way the dentists can fix these at times if you know where the pieces are at. Okay, rinse the person's mouth out with warm water. If there is some swelling, use ice on the outside of the mouth. For pain, try and limit the exposure to air. This is because those nerve endings in the teeth can become exposed with a broken tooth, and nerves that are exposed are very, very, very sensitive to changes in temperature. If you suspect a jaw fracture, try and stabilize the jaw the best you can. You may also seek a dentist to get that taken care of. And then we're going to talk about a knocked out tooth. There are specific ways, to transport teeth to preserve them. Okay, for a knocked out tooth, you're going to try, if you can, to re-implant the tooth. The best place to transport it to preserve the tooth is inside the person's mouth. If you can put it back in the socket where the tooth was out and it will stay, then that's the best place for it. If not, here are some options. And this is a quiz question, okay? To store a tooth when you transport the person to get care, there's a few options. The first one, so this is like a brand name. I'm sure there's more brands than this, but Hank's Balanced Salt Solution is made specifically for transporting teeth. Okay. You can use an egg white, coconut water, whole milk, and or sterile water. It's really just to keep it clean. Some of these things do have like calcium in them to help preserve the tooth and those sorts of things. But then get them to a dentist as soon as possible so you can get the tooth put back in. All right. For an infected or abscessed tooth, so some things to look for. You'll probably see some swelling in the gums around the tooth. Their breath may stink really bad from the infection. And pain may increase with tapping on the tooth with something metal. To take care of it, rinse the mouth out several times a day. Give some over-the-counter pain medication, and then take them to a dentist. For cavities. Cavities, a lot of times they're going to have that same sensitivity to temperature changes or things that are really high in sugar. They also may be really sensitive to touch. Rinse the mouth out with warm water. You can apply oil of cloves. That can help. And then seek a dentist ASAP. All right. So pivoting now to spine injuries. Hopefully all of us know what the spine is. The spine is made up of little bones that encapsulate the spinal cord. Okay, runs from the base of your skull all the way down past your butt. To the top of your butt, I guess. Um, but yeah, it's made up of a whole bunch of bones that are stacked on top of each other. That help protect really important your spinal cord, which is super, super important. And we remember when we talked about that with the central nervous system. From your spinal cord run a lot of nerves to the different tissues in your body. If a vertebrae breaks and pushes on any of those nerves, it can cause paralysis and or severe debilitation. Anytime there is a significant injury or significant trauma, there's always a chance for a spine injury. Things like car crashes, things like, big accidents. Okay? Anytime somebody's unresponsive and you don't really know where the injury came about, you should suspect a spine injury. Okay? That needs to be ruled out before we're moving the person. Again, back to that idea. If somebody is reliable or they're responsive and they have signs of a spinal injury, so some things to look for: back pain. If they're starting to have numbness or tingling down their extremities, that's a big sign of some sort of a nerve injury. Okay, tenderness or pain directly on the spine is a big one. And then if they're unable to move limbs or have sensation in those limbs, those are really big red flags for spinal injuries. All right. So if somebody is exhibiting these signs of a spinal injury, call 911 and do not move them. We want to hold them in C-spine, which means we are holding their head still to prevent their neck from moving. Okay. And then we're going to also monitor for signs of shock by preventing heat loss and, watching for those other signs. Some things to look for: pay attention to how alert they are and make sure that they stay responsive. Check on them periodically to watch for that. Look for making sure that their pain's not getting worse or neck pain isn't coming about or neurological symptoms aren't starting. That could be an indicator that things are getting worse. And then also watch for them. Totally did not understand what I was just talking about. So this slide is referring to somebody that is responsive but doesn't have signs of a spinal injury after a big accident. So some things to watch for, just because they don't have pain right on their spine, we want to make sure they are staying alert. We want to make sure that neck pain isn't appearing or they're not starting to get neurological symptoms and that they're able to move their extremities. Okay. If the spinal injury is not suspected, then you're just going to treat their other injuries. So, last but not least, people who are unresponsive. Okay. Of course, if they're unresponsive, if they're knocked out, they're knocked out. But if they're not completely knocked out, but they're just not with it, that's a big sign for a spinal injury. We may also watch out for intoxication. Maybe it's not a spinal injury. Maybe they're intoxicated. Okay. They may be combative or confused. Or the injury can also be really distracting. So this is something that I see that happens a lot, especially with people that get knocked out. So the second they come to, the first thing they want to do is stand right up. And it's our responsibility as first aid providers and caretakers to make sure that we keep them as still as possible. If they have a spinal injury, we don't want them standing up and running around because that could make things significantly worse. Okay? If they're unresponsive, we're going to assume that there's a spinal injury. Okay? We're going to stabilize them the best we can until we can rule out a spinal injury or EMS arrives. Okay, that is it for the chapter on head and spinal injuries. Again, if you have any questions, please reach out. Feel free to look back over this lecture as often as necessary. We'll review things a little bit next week. And yeah, look forward to seeing you guys next week.